Hi, I'm Dr. Brian Prax, author of Reversing Peripheral Neuropathy, Making the Impossible Possible, and today's video comes to you from none other than G.I. Joe. These are the 5 tips coming from G.I. Joe about your peripheral neuropathy. All right, he didn't really talk about peripheral neuropathy, I don't think, ever. But the thing is I want to quote G.I. Joe because this quote came to me and I thought, wow, G.I. Joe was a philosopher. So he asked the question, or made the statement rather, G.I. Joe said, knowing is half the battle. Knowing is half the battle. And wow, isn't that so true? So whether we're dealing with peripheral neuropathy or how to win a battle, knowing is half the battle. So knowing what? Well, with your peripheral neuropathy, the first thing that most people need to know that helps out, the top 5 G.I. Joe things about knowing. Number 1 is knowing what you have. So some people are unsure if they have peripheral neuropathy. They think they have some of the symptoms, but they're not exactly sure. So knowing is half the battle. If you know that you have it, then that's half the battle. Now we can work on what it is that you have. There's a lot of different things that foot pain could be, like plantar fasciitis, neuromas, a whole bunch of different things. But if you know that you have neuropathy, that's half the battle. The other thing is, well, is it treatable? So now I know that I have peripheral neuropathy. Is it treatable? Is there something that can be done about it? Now, when I say treatable, doctors will treat or manage it with medications like gabapentin, Lyrica, Neurontin, and things like that. I suppose you're treating it. You're not really treating the cause of the problem, but you're treating the symptoms. And if that's good enough to help you to feel better and you're okay with the side effects and the potential dangers of it, then so be it. But that leads me to the next question, number 3. Is it reversible? Some cases of neuropathy are completely reversible, some are not. So some people would be happy with 10% reversal of their neuropathy and symptoms and condition. Some need to get 25, some may get 50 or 75% reversible. But is it reversible? Knowing that would certainly be half of the battle, or maybe 1/5 of the battle. The other one we need to know is, are there alternatives? Well, if this is the first video of me that you've ever seen, let me just tell you point blank, yes, there are alternatives to gabapentin, Lyrica, tramadol, opioids, and other things. And check out my other videos because I offer a lot of good content, a lot of information on things that you can actually take action on at home. But are there alternatives? Yes, there are. And the last bit of G.I. Joe philosophy, knowing is half the battle. What else do we need to know? Have other people had success with it? So with regard to your doctor, ask him, well, has anybody else done well with this medication? If so, that's a valuable information to know. In our office, we actually have a wall of fame. It's filled with testimonials after testimonials. I couldn't fit enough on the wall, so check our website and even check YouTube because we have a ton of different videos from other folks just like you who suffer with peripheral neuropathy, probably from a similar cause, who've already been through the program, who have had success with the program. So that's probably half the battle too. We got 5 halves, so I guess it's 1/5 of the battle. But have there been other people who have succeeded in our program? The answer is yes. And if you're considering a program like this or others, I think it's helpful to be able to read other stories. People who have been through it, who've gone through the battle, so to speak, and who have succeeded and got to the other side. Anyway, there's your G.I. Joe top 5 things to know on peripheral neuropathy. Bottom line, knowing is half the battle. Now that you know, feel free to give us a call, 434-977-5433. Shoot us a comment here below. I will reply to your comment. Check out other YouTubes. You have a lot of different action steps that you can take. I'm Dr. Brian Prax, and we'll talk to you soon.